We're going to talk about psychological disorders. Take your clickers out for me if you brought them. Here's what I'd like you to do. Click in if you haven't yet. And I want to ask you a series of questions. Turn on your clickers real quick because I'm going to turn this off and we're going to go to a series of questions. What I want to do is ask about your experiences in your own families, but also in interacting with the public, that is strangers out there, about any encounters with people that you thought had a psychological disorder. And what I'd like to do today is just simply start the conversation about what psychologists know about certain kinds of disorders, the prevalency, the types, and the characteristics of some disorders, and then we'll go from there. So here's what I'd like you to do. Let's start with the first question. All right, question number one, yes or no, and it's just simply this. Have you ever had an encounter with a person with a mental disorder while in public, like at a mall or a supermarket or the airport? Have you ever had an encounter with a person with a mental disorder while in public? A, yes, B, no. Just by show of hands, we'll show this in a minute, but how many have had within the last maybe month or two an encounter? Anybody even recent like that? That's a lot. We'll see what here, for you, there are by far the vast majority, 320 some of you said you have had an encounter in a public location, and very few of you, only 35, have not. Let me ask this, and it's the next question. A is yes, B is no. Did you feel uncomfortable in this encounter? One of the things we're going to talk about is mental disorders oftentimes lead to us feeling uncomfortable, and we'll talk about what that means. The unknown sometimes comes into play. You can see the answers up here. About a little more than half, 2/3, said you did feel uncomfortable. 219, 134 said it didn't make you uncomfortable. Did you feel that the person's behavior was unpredictable? A would be yes, B would be no. Did you feel that the person's behavior was unpredictable? Unpredictable simply means you weren't sure what was going to happen next or how they were going to behave, which maybe caused the uncomfortableness for some. But was it an element of being unpredictable? And that seems to have captured even more than, that's probably like 3/4 of you said yes, 267. 80 said it wasn't the unpredictability side, but maybe it was this, not unpredictable or both unpredictable. Did the person seem dangerous? A, yes. B, no. Did the person seem dangerous? We'll talk a little bit about the relationship between psychological disorders and aggressive behavior or dangerous behavior to others. And we'll mention that here in just a minute. And the answer, by the way, for most of you, they didn't seem dangerous for 270 of you, but for a few, 75, it did feel that there was something about danger involved, maybe to you. And then let's start with a more personal question. Are there any members of your family that suffer from an anxiety disorder? We'll talk about anxiety disorders being in the categories of phobias or panic attacks or something called obsessive compulsive disorders. Are there any members of your family that suffer from an anxiety disorder? If you're not sure, then you don't have to answer. It would be, but again, it's all anonymous. The answer, or the numbers, by the way, are about 2/3 say no, about 1/3, which is a good percentage, about 146 say someone in their family suffers from. phobias, panic attacks, or obsessive compulsive disorder. Another personal question, are there any members of your family that suffer from schizophrenia? This one you usually don't have to guess at because oftentimes it comes with a diagnosis that you're familiar with. So are there any members of your family that suffer from schizophrenia? Anybody know the percentage of schizophrenics? What likelihood you will find in a given population? What are the percent of people that will suffer from schizophrenia? Anybody know the number? Well, you'll know it by the end of today. Answer? 28 people in here have a family member that suffers from schizophrenia. 28. By the way, it strikes, on average, 1 in 100 people. 1 in 100 people will be diagnosed with schizophrenia. And let's start with another one, somewhat personal question, but it will give us an idea, and that is, are there any members of your family that suffer from depression? By the way, I'm going to define all of these terms, not only anxiety and schizophrenia and depression, but even what a psychological disorder is, and then I'll give you a chance. If you have questions about psychological disorders that you would just like to ask, write them down, raise your hand, and bring them up, because today's the day as well as next time we meet. By the way, as far as members that suffer from depression, almost half, 50-50 in this room. So 160 people out of those that clicked in said yes, someone in their family suffers. Does that strike you as a big number or a little number? Half the students in here have somebody in their family that suffers from depression. That seems like a big number to me. All right, so it gives you a sense that what we're dealing with is a fairly widespread area of experiences that we have, that disorders seem to affect most of us in here in some degree, shape, or form. Here's what we're going to do. We're talking about what disorders are. Is Monk still out there? How many have ever seen this show before? Oh gosh, almost all of y'all. How many love this show? It's a fun show. Why do you like it so much? Well, he's got a very interesting, I'll be honest with you, I saw maybe, I don't know, maybe I've seen it once or twice, I think. I'm assuming he suffers from something called obsessive compulsive disorder. And we'll talk about accurate reflections and are these accurate accounts when it comes to media's representations of some of these things. So let's just start with a quick introduction. You don't have to put any of these numbers down, but this one is I think, one of the most shocking numbers, and that is in the percentage of the population reporting a mental disorder in their lifetime. Basically, it's 50%. 1/2 of all the people will eventually report a mental disorder. Now, that could be substance use disorder, which you might recognize as someone that deals with an alcohol addiction or an addiction to some other substance as a good percentage of that. But anxiety disorders, 1/4 of those will be in the area of anxiety, 20% in mood disorders, and in about 1% of the time it's schizophrenia. What does this say to anybody real quick? 50%. Surprising number or not surprising? How many say that's a pretty surprising number? Yeah. 50%. In their lifetime will report a mental disorder at some time. In this, the proportion of the population that meet the criteria for a disorder, again, same kind of thing. These are in any disorder meeting the criteria, and these are the different ones which we'll talk about. One other keynote, and this is related to meeting somebody in a public place. You could have met somebody with a psychological disorder. If you were in this country 40 years ago, it might not have been as prevalent or likely as it is today, simply because of a change in many of our the laws in how we treat somebody with the psychological disorder. For a long time, inpatients, that is somebody who you could put into a hospital and leave there because of a mental disorder. If there was a time in this country where if you had a doctor and or you can convince a person in authority that the person you were interacting with was disordered, they could put them into an institution until they could prove that they were not disordered. And so they would literally end up in places. Now again, you needed a doctor to confirm this, but it wasn't that difficult to put somebody into an institution because you thought they were suffering from a psychological disorder. That has been changed now. So if you suspect that somebody is, they could go into, for an evaluation period, but say, I don't want to be here. You can't keep me against my will. And that is, these state and institutions will not keep you unless you're a danger to yourself or to somebody else. And so a lot of individuals will say, I don't need help. I'm not disturbed. I don't have problems. And so they end up not being able to oftentimes care for themselves or get the help that they need, but they're convinced they don't need it. And so they end up frequently on our streets, living in places, just trying to survive. And so this declining spot right here, this slow movement down out of inpatient populations is correlated with an increase in people that are in outpatient treatment. It has a lot to do with the way in which a person can now determine if they want to be hospitalized or not. Again, in some cases, they don't have a choice. Danger to themselves, danger to others. They will be put into an evaluation, into a longer evaluation period. So today, the number of people that are dealing with major psychological disorders among our homeless is going up all of the time. Probably the estimate is anywhere from 1/3 to 1/2 of homeless are dealing with a psychological disorder. Well, this puts all kinds of pressure on people to actually even come up with what does it mean that a person has a psychological disorder? Let's start with that question. How do you know if a person has a psychological disorder? Some of you told me that you interacted with somebody in a public setting and you believed they had a disorder. Tell me why you thought they did. They were talking to themselves. Is talking to yourself a sign of mental disorder? How many suffer from that on a regular basis? Yeah, half the hands went up. But there was something different about this, wasn't there? This person, oftentimes that we see, is carrying on a conversation with themselves and nobody's there. I told you my story, right? About the person that was talking to himself as he walked past my office over there and was banging and yelling and screaming. You remember that story? There is something different when we talk to ourselves, it feels like. But when somebody does this in a public setting, we tend to think of that as, okay, that's not normal. What else? How else did you know, or why did you think that this person was disordered? Maybe what they were saying, like you say how they spoke, or okay, just maybe there's some different things about their quality of speech, right? Their quality of speech influenced that, yeah. Okay, they were having a conversation with nobody on a phone that didn't work. Maybe there's, for some, we might think that they're showing what we wouldn't say normal emotional reactions to things, right? Good, yeah. Okay, there's a lack of maybe knowing socially what's going on or what's appropriate or what's not. Body language tells us what? That they're feeling emotions intensely, or... Okay, there seems to be something off. Or erratic, strange behavior. And massive mood swings. Okay, so great examples. Ready? The answer is, it's really hard to define what's a disorder and what's not. There was a student who went to this school here who never one day in the 4 years I saw her, I told you this, never wore shoes. in 4 years. Not at the first day of classes and not at graduation and never in between. I never saw her wear a pair of shoes. Now in this part of the world, that's probably not that difficult, but is that weird? It's a little different. In Colorado, I'm lecturing just like this to a class just like this at Colorado State when I was first starting, and there were doors just kind of like this, and there were trash cans outside of the doors, and every Tuesday and Thursday during my lecture time, a guy wearing a sombrero, singing songs very loudly in Spanish, listening to, with earplugs in or headphones, whatever he had, singing out loud, very loudly, songs in Spanish, wearing a sombrero, collecting cans from all of the trash cans. Is that a psychological, is he disturbed? Does he have a disorder?
Don't have enough evidence to say.
His singing wasn't that good. But that doesn't mean he was disordered. Collecting cans, wearing a sombrero, all of these things are like, well, there's something different about that. It's odd. But does that make it a disorder? Bottom line, how we define disorders, there's no easy, straightforward formula. If you're sad and you stay sad for 4 days and you can't get out of bed for 4 days, are you suffering from a depressive disorder? Well, there are criteria that help. There are ways we begin to define disorders. What is abnormal? Is wearing a sombrero in this culture, right here where we're at, in this location, is that abnormal? And some of you qualify with some of the things you wear because sorry, I didn't mean that about you. So what is it? How do we know this line? Where does the light green separate itself out from the dark green? Where do we draw it? Do we just say, oh yeah, anybody here, that's abnormal? What would be some criteria we could use? Are they successful? Did the guy, maybe he made a living, with collecting cans. Maybe it wasn't maladaptive at all. It was fairly adaptive. That's a great criteria. Does this make him unable to be employed or feed his family or himself? Or are they able to function? Well, we start looking at some of these, and there's just a real quick guide to how we define a psychological disorder. One of the first ones is, are they statistically deviant? If the answer, by the way, you start going down and you start to ask, well, is their behavior atypical? Do they have any sort of... The person who didn't wear shoes, that's atypical. Give me some atypical behaviors that you've noticed around that's some people maybe here do, that's just statistically outside of the norm. Wearing a cape. Hey. Anybody else? Maybe we won't do this then. I'll stick with my stories. This lady, who is she? She's a deviant. She's abnormal in one category. Her name, Marilyn Vos Savant. Remember me telling your story? Marilyn Vos Savant. Did I tell you this? She scored highest score ever on an IQ test. She has the highest score on an IQ test. She beat me by like 1. I was so mad. I was like, dang, that's bad, like that. But I used big words. So is that atypical? Uh-huh. Is she at the far end? Uh-huh. Nobody's out there with her. That doesn't make her abnormal, does it? All right. The other thing is, another layer we have down real quick is it unjustifiable? Does a person's behavior violate our cultural standards? Now, wearing a sombrero, kind of borderline, I guess. It violates some of our standards. If you dress up in cross-gender clothing, in most places, that's weird. That's what we call violating a cultural standards, but not in all cultures. How about this woman, right there? Lady Gaga. Does that violate cultural standards? Much of her behavior violates. Does that mean she's abnormal? No, it doesn't. Doesn't mean she's abnormal by the definition that we're trying to get at, which is, for her, it's a little bit of an atypical, unjustifiable, a little bit odd or weird, but does it cause emotional distress? That's another very important category, and I would guess the answer to this one is neither the person who was barefoot, nor the person who collected cans wearing a sombrero, nor Lady Gaga find emotional distress in their behavior. They don't say, this is undesirable, I don't like this, I don't want to be here, this makes me depressed, I want out, I can't stop, right? So therefore, if it doesn't meet all of these criteria, we tend to not define it as a disorder. It's maladaptive, as someone said. Does this person function and get along well? Well, adaptive usually means they can behave or act in a certain way that allows them to live a life in an adaptive way. That's another one. So, all that to say, in defining normality from abnormality, this is varied over time. It's changed by culture. We try and put these things on here so that if you put down a behavior that's both includes being atypical, unjustifiable, undesirable, and maladaptive, it gets a little bit easier to say, yes, this is behavior that seems normal. That clearly falls here in the abnormal, and it gives us a way of trying to define this. Still doesn't make it easy. Okay? There are situations in which people do things that are very weird and different. If it happens, by the way, I just want to make a real quick clarification that if it happens in a legal setting, we call that impaired judgment. And so we define, the legal system would define impairment and hence abnormality differently. They call it sanity or insanity. And you've heard of an insanity defense that goes with somebody who, what's the insanity defense mean? A person who is not fully aware or able to control their behavior is what we call impaired, and so they are not treated the same way when it comes to convicting them of a crime they committed. If they committed the crime during a period in which they lacked self-control, had impaired judgment, what we call insane, you can actually, a guy who shot the president of this country, Ronald Reagan, the guy who shot him, John Hinckley Jr., claimed that he was insane, and by the way, evidence was clear in his case that he was insane, and therefore he was convicted of a different charge than he would have been if he would have been sane. So John Hinckley Jr., one of the evidences that he was not in full control, believed that if he shot somebody important like the president, then Jodie Foster, the actress, would love him. And he believed, he had lots of issues that were going on. Now here's the thing with John Hinckley Jr. He's still serving time, but at a state hospital for the criminally insane because he shot the president. But he can leave the day he what? He can leave. Anybody that's convicted of a crime of insanity, should they serve whatever amount of time they have, they'll stay there until the day they prove that they are sane. If you prove you're sane, you're out. That's it, because now there's no longer any danger that you're showing to society because you were insane at the time this happened and now you're sane. Does that make sense? Do you think how many believe a lot of people who are tried as a criminal or a felon and go to court claim to be insane? What percentage do you think people do that? They say, oh, I was insane at the time, I don't want to be convicted of this, I want a lesser charge. How many believe this is fairly common? Yeah, a lot of you. How many think it's like, I don't know, not that common? Well, the answer is, it's exceedingly uncommon. It almost never happens. Less than 1% of all felons that are tried and eventually convicted claim the insanity defense. And the reason is, it's still on our books as a humane society allows this for individuals that suffer from this. But to prove it or to validate it is very difficult. Anybody from San Francisco area, your downtown area is known as what? What are your main convention centers? Called the Moscone Center. Why is it called the Moscone Center? How many saw the movie Milk? Remember it? George Moscone was the what of San Francisco? George Moscone was the mayor of San Francisco. He fired the city supervisor, two city supervisors, one named Dan White. And as he fired them, Dan White went home as city supervisor, believed that it was because he was outspoken critic of homosexuality, and that he went home, got a gun, climbed through a window to avoid the metal detector, went up to the mayor, George Moscone, bam, 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 shot him 6 times, killed him, went to the city supervisor next to him, Harvey Milk, bam, 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 shot him, killed him, and he went to court, went to trial, claimed a lack of awareness of ability to have self-control and impaired judgment, and that he ultimately convinced the jury, and one of the arguments that showed and demonstrated that he was insane was that the only thing he had eaten for the last 6 months were Twinkies. And there was evidence presented in court, I think it was 3 months, maybe not 6, but either way, his only meal consisted, every meal of every day consisted of this, and the jurors went, wow, nobody that's thinking rightly would eat a Twinkie for that long and that often and that frequently. He was convicted not of first-degree murder, but of manslaughter, and was released from his sentence about 4 years into after he was, about 3 or 4 years later he was released, which, by the way, he committed suicide a couple of weeks after being released. That was Dan White. All of that big story to tell you that insanity is not a psychological definition. We deal with what is a mental disorder, and to classify them from a psychological standpoint is very clear, though oftentimes re-updated and edited versions of this book called the Diagnostic Statistical Manual. And in it, do you guys have one? If you go through a PhD or a PsyD program or any type of training at the graduate level, you will probably own and buy this book. And inside of this DSM, is it now DSM-5? Has it come out yet, or is it not yet? But it's coming, and that is a revision of this. But inside you can see a listing of almost every psychological disorder. And it lists, its aim is to name and describe all of these disorders, but it also says the criteria by which you would be able to diagnose somebody with this disorder. What are the characteristics? How frequently does a behavior have to occur? What are the likelihood of certain ages being affected, let's say with clinical depression? And then what are the signs that would allow somebody to be able to name this and describe this disorder? Now, the criticism, or not the criticism, but one of the controversies is once a person has been given a label, let's say of schizophrenia or obsessive compulsive disorder or manic depression, that label stays with that person. And then if you're ever filling out a job application and you have to say, have you ever been diagnosed with a psychological disorder, you have to write, yeah, I was diagnosed with clinical depression. And sometimes that's not a good thing in many places in our culture because it does put the person under a different level of analysis, and some employers go, I would not hire somebody like that, even though they outwardly may not say that. That may be how they behave. Here was a simple rating of these two applicants. They thought one, they're the exact same applicant, same resume and everything, except for one of them did say, I was in the past diagnosed with the disorder and was briefly hospitalized, and their level of rating by people on the outside went way down with just that simple label on there. So it does have an effect on how we perceive people, which is why there's a somewhat controversy. There are lots of things, by the way, that we still use. Questions, by the way? Yeah.
Who creates the DSM? What organization?
The DSM is done by APA, American Psychiatric Association. It's a group of psychologists and psychiatrists who sit on a panel. It's a large, extensive group who meet probably every couple of years to update and then put out new versions, maybe every 5 to 10 years. Yeah, that's who it is, American Psychiatric Association.
Does that job label, I mean, does that like label that you diagnose will follow you everywhere? Like, do you have to put it on?
You know, that's a great question. I don't know if I know the answer. Maybe somebody else in here knows. If you are diagnosed with clinical depression and it asks on a job application, do you have to reveal that? Yeah, I guess I don't know the answer, and it probably varies state by state now that I think about it. So, your question was, do you have to do that for the rest of your life by putting that on there? I'm not sure. It's a good question. By the way, just lastly too, there are some things that we no longer refer to that we used to. So, how many of you ever heard of the word neurotic or the word psychotic? It was very common in somebody had a neurotic disorder or psychotic. We don't use that anymore. It's still out there in popular language that there's such a thing as a neurotic disorder or a psychotic, but the psychotic is still there. People still can have a psychotic episode but we don't use the word neurotic as now one of the categories of somebody, but it has stayed around in our kind of common language use in the culture. But neurotics would be, in the past, would be somebody, I don't know, that would have a disorder that may not be all that, like, you might think of, like, say, a neurotic would build castles in the sky. Have you ever heard that? They build castles in the sky. That is, their feet is, planted in reality, but they just build castles. And then the psychotic would what? They would live in those castles. That's the kind of way of knowing. Psychotics are a whole level different. And then the psychiatrists come along and collect the rent. That's the difference, too. We don't use that terminology because now it's been specified a lot more cleanly, and I'll show you some of that in just a minute. One is in the area of anxiety. I'm going to talk about 3 major disorders that we group broadly into the categories of anxiety, mood disorders, and then schizophrenia, okay? So if you have questions about any types of disorders that don't fit in there or you wonder about, certainly raise your hand and ask, and we'll go through that. When is anxiety normal and when is it not normal? How many of you all have felt anxious sometime in the last week? You felt anxious. Almost every. Can I ask somebody with your hand up? How did you know? How did you know you were anxious? What went on with you, or what did you feel? Restless. How many say you felt restless? Okay, that's a good one. Anybody else have a different symptom? How many have, when you feel anxious, your stomach gives you problems? Stomach ache or pain. Anything else that you knew caused you, or you felt, when you felt anxious? What's that? Lip quiver. Okay. How many felt that before? Your lips like, only him, all right? It's kind of quivering. No, it's not. Shaking. How many sweat? How many sleep a lot when you get anxious? How many sleep a lot when you get anxious? How many don't sleep when you get anxious? Just the opposite, yeah. Okay. When is your anxiety and your symptoms, the things that you're describing, when does it become what we call abnormal? If your feelings of these things, feelings of dread or doom, persist over time and are distressing, you are experiencing, or at least this is one definition of anxiety, a distressing, persistent feeling of dread or doom. Bad things are going to happen, are happening, and you're feeling this dread going on. Now, there are different levels of anxiety. I'm going to show you some very clear-cut cases, and there are lots of different ways that this comes into play. Generalized anxiety is a broad category that is just simply anxiety that's long-lasting, or even a kind of apprehension that we call long-lasting. You just feel this. And generalized anxiety you may not identify a specific cause or thing going on in life. It just feels like it's long-standing, and we would, again, call that anxiety. Now, if it has a specific thing, the most specific type would be something like a phobia. A phobia could be about almost any specific thing. Does anybody have a snake phobia or a spider? Sorry. It's an unrealistic fear. Anybody? There's a picture does any. For some people with phobias, maybe even seeing a picture isn't a good thing. But I'm assuming most of you are all right with this. Unrealistic fear of a specific situation, thing, or activity. Anybody have one in here that, or know somebody that has one that isn't up here? Like
Fear of going over bridges.
fear of going over bridges. How many have that one? Anybody have fear? A couple people? Yeah. Others, fear of heights. How many have a fear of heights? Acrophobia. Any other ones that you know of? Yeah.
I heard of someone who had a fear of taking left turns.
Someone who, yeah, who, okay, don't know if it's true. Could very well be. Yep.
Fear of frogs.
Fear of frogs. Not you, but somebody. Yeah, that's fine. We're not talking about. Fear of getting diseases. Yeah, what's that called? Anybody? Yeah. Hypochondria. Way back there. Fear of dinosaurs. Yeah. That one died out, though, a long time ago. It's not around. It's still not. It's still there. How about fear of, how about Santa claustrophobia? Have you heard of that one? It's fear of getting stuck in a chimney. That's a drag. That wasn't even really all that funny, huh? Santa claustrophobia. Listen, phobias for the person that suffers from these can be very powerful and very debilitating. Best thing is, though, it's usually a specific thing they can avoid, like spiders or snakes or chimneys. But it also is sometimes more devastating if it encompasses things in a daily part of life, like crossing bridges. Number one identified, snakes. Okay, heights, flying, storms, and dentists. Which would really, when you think about going into a profession, to have this up there that people fear you, going to a dentist. By the way, for fears specifically related to social phobias, there are 8% identified that speaking in public, speaking to strangers, even eating in public, could be very difficult for them. So you can see how this would be a little bit more interfering in life. They're very common. Anybody know the most common, or at least the one besides this specific thing of a snake, the broad category of phobias? It's like acrophobia, but it's the most common, at least we believe, that people suffer from. But you know what it's called? It's called a fear of open spaces, or fear of fear itself. It's known as agoraphobia. Agoraphobics would be those who are afraid of or associate being out in an open space or even outside of their home with something like panic or a panic attack, and they're just afraid to step out and sometimes end up living the majority of their life without ever leaving their home. This is not uncommon of a phobia. Agoraphobia, I have a little video clip on it I'll save for just in a minute here. But it would not be uncommon for a person that was suffering from agoraphobia to just simply stay in their house and everything's fine. As soon as they leave, they're afraid they're about to have some sort of attack or anxiety, panic attack. Agoraphobia, however, it has more than just leaving the house. It can be related to a fear of bridges, fear of tunnels, fear of going through public transports, or even being in crowds or by oneself. Okay? Questions about phobias or agoraphobias? When they listed, by the way, they asked different people, what's your most common fear? Survey of 1,000 Americans about 10 years ago, they found a difference between men and women. What do you think was the number one top 5 fear of men? And it wasn't women. What was the number one? Getting rejected. Top fear of men.
Death.
Death. What? Heights. For men now. Number one fear of men? Showering? Wow. That was funny. Fear of being buried alive. How many now have that fear now that you think about it for just a second? Number one fear for women identified in this survey was? Anybody? Fear of women. Number one fear? Fear of snakes. Tell you, you don't have to write all these down. I'll just put them up to show you. They're about the same in some cases. Fear of heights for men, fear of being bound or tied up, fear of snakes, number 3. Fear of being buried alive showed up for women. Fear of drowning, fear of heights, fear of public speaking, and fear of public speaking. This could change. Again, this was just a survey of Americans 10 years ago. It might be different today. It might be different in this class. Causes of phobias are all over. Probably some of the most likely causes of phobias involve associations and learning. Not always, but some object becomes associated with anxiety or fear or somebody screaming that or somebody grossing out, and you see that same object and now all of a sudden you have a similar type of association. And classical conditioning processes that we talked about in here. The reason we know that happens is because we can take somebody, and one of the most common treatments, which we'll talk about in therapy for people with phobias, is what we call using conditioning processes, counter conditioning. But did you have a question? Yeah, arachnophobia is high. Like I said, it was just in one of these surveys, and fear of spiders is still fairly common. It's just in that particular survey. Okay, enough about phobias, unless you have, yeah? The answer, yeah, we'll talk a little bit about what are some treatments for phobias and for phobic disorders. The most successful, some of those have been things like counter conditioning, but we'll talk about some others that actually expose people to the very thing they're afraid of in a controlled environment, which actually starts to lessen or decrease, if done the right way, decreases their feelings of anxiety and decreases their phobias. And so that one we'll talk about. By the way, obsessive compulsive disorders are also what we call anxiety disorders, but they involve a slightly different element in that they involve both an obsession, that is an unwanted or a persistent thought, and oftentimes a repetitive behavior, which we call a compulsion, which is where we get the word obsessive, the thinking part, unwanted, continuous, persistent thoughts of something you don't want. And then the compulsion, which is this behavior that oftentimes is repetitive. Give me an example of either the thought or the compulsion for some people suffering from what we call an OCD, obsessive compulsive disorder. Yeah, there are many cases that would have somebody who would be afraid or have this obsession that they didn't lock the door when they went to bed at night. So they go back and check it again, and they check it again, and they're doing this 15, 20 times before they feel safe to lay down and the door's been locked. Not uncommon for us to maybe feel like, did I lock the door? Maybe when I checked it, I unlocked it, doing it a couple of times. When it becomes interfering with normal functioning is when we start to find problems. Yeah, go ahead. Question? Way back there? No? Yeah, yes, good. Fairly common one. In fact, one of the most common compulsions is hand washing because of fear that you're contaminated or have germs. And I'll show you a video clip of this. They become problematic, by the way, as I mentioned, when they interfere with daily functioning. So let me show you, in this case, a person that deals with a fairly devastating compulsion. And here, it's both hand washing and fear that about what could happen. And here is this young mother, her struggle with OCD. But that would dominate and interfere your life, right? I mean, that's an unmanageable anxiety, and the only way she's managing is by doing something so detrimental. It begins to be a problem then in situations like this. Hers, by the way, isn't necessarily uncommon. In severe cases, this is what you find. Cases where people just say, I can't live with this anymore. I don't know what to do. And medication, by the way, we'll talk some about medication and treatment of some of this next time. But it does help. But any questions from this now about OCD or about phobias like that? It's a very powerful visual of how this causes sufferers to live. Now, she might not ever need to seek treatment because everything, I mean, she has, messed up hands and she can't go do certain things at the right, it might take her a little bit longer to go for a walk, but this doesn't always come to the attention of people because, in some cases it's manageable in their minds. When it becomes interfering with life is when it becomes problematic. So surprising how detailed and shocking this one was. By the way, when it comes to causes, again, there is probably more and more evidence coming out that something is going on physiologically in the brain, quite possibly at a neurotransmitter level, because anti-anxiety medications do help, but it's not the end of the story. There is some therapy that usually must take place in addition, and we'll talk about that as well. But yeah, question? I don't think that's, well, the question is, would her son develop this if she was to stay the same way? My guess is he wouldn't have any greater likelihood, though it might influence some of his behaviors or some of his thoughts depending upon how strongly she expressed it to him. You can see here she was trying to protect him a little bit from it and knew, I don't want him to see this side of me or to do this. So my guess is he wouldn't have, other than the genetic kind of likelihood that's slightly increased with this. But so I don't know. I would say the answer is, ultimately, by the way, for her, treatment does come, and there is some help, which is why she consented to filming this. I don't have exactly how she's doing today, but of all the anxiety disorder, social phobias, quite possibly, 13% of anxiety disorders suffer from social phobia, agoraphobia, which we talked about. Remember, social phobias are a bunch of different kinds, and then obsessive compulsive. By the way, it's going up. This is closer probably now to 8-10% of anxiety disorders, but they just kind of vary over time. Yes? What we're finding is increasing numbers of anxiety disorders. The question is, why are they going up? I'll tell you this, it's a question a lot of people and a lot of researchers are trying to find out today. There is some indication that our lifestyles, by the way, with anxiety disorders going up, your use of technology we're finding more and more cases of anxiety younger and younger. People not getting enough sleep. Any of you all, we go back and look at records, not y'all's, but in studies of texting, and we're finding it going on when? All night long. And oftentimes, a lot of this is interfering with sleep. Sleep has a very strong tie-in to certain disorders. And constantly being on and constantly doing some things without finding margins, quiet space, may be accelerating some of the sufferers of things like anxiety. But again, it's not clear why, but there could be some other things going on in our culture.
Does it have to do with just like the stress level that we live under constantly?
Yeah, and the world is, because of these kinds of things, the world is it feels more stressful. It feels like there's more time demands, pressure demands, and things like that. Question?
Are there people obsessive compulsive over studying? They can't sleep unless they get a
Yeah,
certain
there
amount
are
of work.
some people could identify with some obsessive compulsive tendencies, and even the way you study. How many have to have your room a certain way and the books a certain way, and has to be certain environments? It's not necessarily obsessive compulsive. It's just simply a tendency, and then it could be in a variety of different areas, not necessarily in feeling, clean or contaminated or anything. Okay, next level up. How many saw the movie Beautiful Mind? Beautiful Mind. is a great story. It's even a better book if you want to read it, that gives the full detailed history of a sufferer from schizophrenia that was pretty accurate. It took you, if you haven't seen the movie yet, it was a great way of characterizing what goes on in this person's life. And you only find out later on that the person had schizophrenia. It's a group of disorders. That's an important word. Schizophrenia is not a single disorder, but it's a group. They share some symptoms and some other characteristics in common, and so they've been given the label of schizophrenia, but it's almost always related to disorganized thinking and then disturbed emotions and perceptions. Schizophrenia numbers 1 in 100, fairly consistently across cultures throughout the world. I was in Russia standing at a corner and crossing the street, and I didn't know the language, but I knew the disorder, and it was schizophrenia. It was clear. He was talking to cars that were going by and other people, and again, it was clear schizophrenia. I seen the exact same behavior on the corner over here of an individual. It's for whatever reason, this is a disorder that also strikes not only all cultures, but male and female equally. It is a very difficult group of disorders. Let me show you a little video. Unfortunately, he falls into this category. Oftentimes we call it the law of thirds. A third of people diagnosed with schizophrenic get better. A third kind of go in and out, struggle with it, but there are periods when they're not suffering, and then there are. And then the third, kind of illustrated here, are the chronic schizophrenics that are either in homes where the family is able to keep a person there, or sometimes institutions if case is necessary there. But schizophrenia has these similar, even though it's a group, it has some similar symptoms, and I'll just give them to you real quick. There's these, you saw a little bit in there, these bizarre kind of delusions. Some can be a paranoid nature. A lot of times it's somebody's out to get them. Somebody's out to find them. I'll show you a clip here in a minute of a paranoid schizophrenic who is simply convinced that the FBI, the CIA, the NYPD are all following him. He's homeless. He doesn't have a place other than the streets that he lives, but he is convinced that these people are out to get him, to chase him, to follow him. Kind of like the person I described recently in this class, that I described his situation here in the class, where he came onto campus, wasn't a student, but showed these signs that people were following him, and he didn't even want to urinate in public because people were gathering that up, and so he would urinate in cans and keep those so that no one could follow him. And that's a delusion, or better yet, a paranoid delusion. There are also delusions of grandeur, that somebody is bigger or more important. Not long ago, I bought a guy a meal over here recently, and as we stood in line, here's what he said. I said, "How you doing?" "Fine." "Everything going okay?" And he said, "Yeah, it's fine." And so I said, "Well, let's eat together." And so I was with my young daughter at the time, who was probably only 4 or 5, and we sat down, and it was clear he's schizophrenic. And as we ate, I just asked him questions. Are you getting a place to stay? How's life treating you? All of this. And it's fairly clear right away. He says, "Yeah, I'm fine. My aunt, they're after her. She's the Black Dahlia." And I said, "Your aunt is?" "Yeah, she's the Black, and they're after her a lot." And I said, "Well, so everything else okay in life?" "Yeah. I'm trying to finish." He was probably, I don't know, he looked 20 maybe, and was talking about how he'd had 3 or 4 master's degrees, one from Harvard, one from Stanford. He was just finishing up his master's at MIT, he was saying. And so he had these delusions about things and about life, and a lot of his stories would tumble out in a way we call him like a word salad. But he wasn't dangerous, he was hungry. And so a lot of people think, well, people like that are weird or odd or strange, and they deal with some things, but most of the time there isn't a dangerous quality. Another guy was telling me, a different person, same thing, kind of standing there, how's it going? Fine. I said, what are you doing? He goes, well, I'm getting ready to go back to the old country. And I said, really? He goes, yeah, my sister, she's on the throne, but it's my throne. When I get back there, I will be crowned the king. And I said, well, that sounds cool. You know, do you want mustard on that thing or ketchup? And he's like, no, just nothing, please. I said, okay. And he says, yeah, I'll get back there one day, but, you know, it's hard. Well, I was like 10 years ago. He's still hanging around over here, you know. Paranoid delusions or delusions of grandeur come into play, but there are other symptoms that mark some schizophrenics. Hallucinations, auditory, visual, or tactile. At a state hospital that I did an internship at with the criminally insane, it was not uncommon for them to feel or see things. One believed the television was talking to him and sending him messages directly to his brain. Even if the TV was off, it still had the potential of sending messages to his brain. And those were probably the result of some visual hallucinations. Another person one time believed that, listen to this, every time a dog barked, he'd go like this. He'd say, oh, did you hear that? Dogs are anthropologists sent here from other planets to follow me. And when they would bark, it would tell him that they're following me, they're tracking me. That is a paranoid delusion that has some hallucinatory qualities. And there was this also tendency for what we call a word salad. Incoherent, loose word associations, severe emotional abnormalities, and a sense of withdrawing into this inner world. So here's what I'd like you to do. If you have questions, you can ask them now. I'd like you to make sure you read about, if you haven't yet anxiety or schizophrenia, finish that reading. Read about depression as well. I'll show you a couple additional clips of schizophrenics. Then I'll show you a little bit about manic depression, bipolar disorder, and depression. And then we'll talk a little bit about therapy and how we handle people or deal with these at that level. Any questions as we go? All right, okay, so that'll be on Monday where we'll do that.
Biola University offers a variety of biblically centered degree programs, ranging from business to ministry to the arts and sciences. Visit biola.edu to find out how Biola could make a difference in your life.